Hey everybody, Dr. Ballum here at Legacy Chiropractic. I'd like to take a minute to clarify some confusion that I've heard within the office. And it's patients that come in and they tell me that they've heard from another doctor that they've been diagnosed with degenerative disc disease. And often find that these individuals, they seem like they're disheartened. They feel like there's no recovery, there's no turning back, and this disease process is just going to continue uncontrolled. But I want to give you some hope because there's actually something you can do about it as long as you understand what is causing it. And so to give you a simple analogy first is think about the 4 tires on your car. And all 4 of those tires, if they're lined up properly, should last you the number of miles that the manufacturer said those tires should last for. But as you can imagine, if 1 or 2 of those tires were not aligned properly, as you're driving down the road, those tires are going to wear out faster. And the same is true for your spine, that when everything is lined up properly the way that it should be, your spine can last you a lifetime and you can enjoy the benefit of mobility and full function. But if one of those vertebrae is misaligned, we call that a subluxation. If it's not in the right place, it's putting pressure on the nerves. Well, now, just like those tires on your car, your spine is going to not last the number of miles or days or years that it should have lasted. So as we look at these models here, you can see this is normal and healthy. As we look at the spine model, you can see 2 bones and a disc in between. A misconception people think is that this disc is actually a shock absorber, but it's not. It's actually a rubberized type spacer, just like this model here, and its job is to functionally allow space for the nerve that exits out of the spine. That way you can bend and twist and do all the things that you do in a typical day and maintain plenty of room for that nerve to come out. Now, if that vertebra were to become misaligned, called a subluxation, well, now there's going to be some irritation to the nerve, but also the mechanics of that joint are no longer balanced. They're no longer functioning optimally. So as you can imagine, over time, that spinal joint is not going to last as long as the other parts. And when I look at a patient's x-ray, I'll see one area, maybe in the low back, that has evidence of signs of this going on in the spine. But the rest of their spine looks like this. And we know that that individual's spine, every one of those vertebrae are all the same age, but something happened to one area that didn't happen to the other. So we know that this process has nothing to do with your age. It has to do with the amount of time that that misalignment, that subluxation has been there and that it has not been resolved. And so here at Legacy Chiropractic, that is what we do. I specialize in analyzing the spine for those misalignments called subluxations. And the type of training I've had in the Gonstead method allows me to do that with the highest level of precision and accuracy when I go to do a correction to restore the proper alignment and position of that vertebra in the patient's spine. So that is the message I want to share with you today. So every one of those adjustments you get is working towards restoring your spine towards optimal alignment, extending the number of miles that you'll get out of your spine. So again, I'm Dr. Ballum here at Legacy Chiropractic, and I've got your back.